Hi guys, I'm David Disponett with Transparency Fitness Live, and today we're with Danis, and I'm going to let him tell you guys a little bit about himself. But let me just say, he's an amazing physical therapist, and he's been helping me out for years.
Well, I think I should start the background on how we met.
Yeah.
So won't break too many HIPAA laws, but David was a client or patient, I guess you could say, up at the clinic when we first started out. Still see him from time to time. But yeah, so I'm a physical therapist. I've been practicing now for right at 4 years, or coming on 4 years. Work for a great company called PT Pros. We're a privately owned company where we have been around for 40 plus years. We're have 13 locations. I'm the clinic director at one of our newer locations, which is here in Lexington. And we opened up that location. It would have been like March the 9th of 2020, and had some bumps in the road, obviously, with the lovely pandemic, but we came through on the other side. And it's been a really a fun ride as far as that's concerned.
I was actually kind of a dick to the guy when we first met because so I'm a veteran, and so they'd always sent me to a different PT clinic in the past when I had knee issues. And this last time they were like, "You're going to go to PT Pros," and I'm like, "No, I want to go to this other clinic. I already have a guy. He's been working with me. Like, I don't want to go to another guy." And they're like, "Well, this is how it is. This is how it is. This is where you're going to go." And I'm like, "Okay, I guess if I want PT, I got to go here." So I go here, and I'm like, "Hey, like." Pretty much like, I'm really sorry, but I'm still trying to get the VA to send me to this other guy. They never would, and I've been seeing like over a year and a half.
Probably off and on and stuff like that.
Yeah.
And it was first thing he said to me was just like, so I have this other PT that I really like a lot. All right, cool, man.
And Ian pretty much like, challenge accepted.
Yeah,
Let me show this guy a thing or two.
So it's been I think it's been one of those things. And when you're in the PT world and you're in the fitness world and that type of stuff, when you start working with people, you develop a bond with them that rolls into, friendship type stuff. You learn a lot about the person, and clearly that's kind of, I would say that's where, we've crossed over too, which is a lot of fun. But that's why I like, I should say, like what I do is, not only do I get to physically help people, make them feel better and stuff like that, but the relationships that I develop with my clients or with my patients are just
the relationships are important for their benefit.
Correct.
If they trust you,
yep,
and they see those changes, because I mean, almost at first you got to sometimes, like me, you had to prove to me that you knew what you were doing, that you could help me.
Yep.
And once you did that, I was all in with you.
Yeah, and it's and everybody's different. It's one of those things of. Some people need a bunch of analytical or scientific knowledge thrown at them to create the buy-in. Some people, I've done the first time I meet some people in evals and stuff like that, where all I do is I sit there and listen for 45, 50 minutes, because they just keep going. And that's as much as a therapy session for them. Sometimes it's frustration from going from one provider to the next provider to the next provider. That's they're fed up because they feel like they've been sent all these places and they're not feeling any better, and those types of things. But yeah, I've been, like I said, I've been doing it now for 4 years. I wouldn't want to do anything else. I love what I do.
You're good at what you do.
Yeah, well, there's that aspect, I guess, of it. But no, I mean, it's it's something that I've been able to morph, I think, a lot of my, like, what I am good at, and it's really fits my personality. It fits what I'm passionate about. It fits, I go into work, I have to think every day. It's stimulating, when new people walk through the door, there's a lot of figuring out that you have to do. And then it's also rewarding at the end of the day.
Well, problem solving's fun.
Yeah,
like getting in there and that challenge of problem solving, like, especially when the person comes in and goes, "You know what? I feel so much better since I've started doing this."
Yep.
Because you've actually come up with stuff for me. You're like, I'm like, this is what I want to work on, and this is what I need help with this week. And you're like, all right, I'm just gonna come up with something.
Yeah, exactly. No, and there's the creative side of things, where you where you truly find what something is giving people problems, but then also, like, how are we gonna work on this to make it fun? Also, like, all at the same time. Like, I think that I try to have fun at work, and I think maybe it's evident from, like, coming in and seeing both Norm and myself and MJ and the staff, like,
very positive environment.
Yeah, but I think I think we're true to that, though. I don't think it's like we say, hey guys, we got to be positive today, X, Y, and Z, you know, and try to, you know, look like we're having fun. I mean, we all are dragging on certain days, and we all, I think, help pick each other up in the clinic. But I mean, at the end of the day,
well, there's a lot of cross conversations that I really like. So, like, Norm, which is another physical therapist there, that's a fantastic. No offense to you, but I think he may be the happiest person I've ever met in my life, because that dude never stops smiling, and everything is just positive exuding from that dude's mouth.
It's contagious.
It is. But yeah, he'll take the time to check. I mean, I'm not even his client, right? And I think he's had me one time when you were like out of town, and I needed a session, and he took over. But he always asks how I'm doing. He talks to me, and he remembers things when he checks up on me. And I think that's really awesome.
And I think that's and that, like you said, it makes you feel like you're not just with the singular person. It's like you're coming to a place, and the team is there for you to get to make your goals. And as a company, you should, like, you know, not directly that you see this, but even from like top down within our company, we talk very much so about team and teamwork and that type of stuff. And I think it correlates because I've had some opportunities to be in other clinics across the company, and you see this whole team aspect across the board. And that's more so company culture, I think, that they've developed, you know, than anything else. And so,
well, if you have your employees buy in to a good culture,
correct.
Then like, I mean, you look at something like Apple, and their culture and where they started and how they've got where they've gotten, and again, it goes back to connecting with people. And you know, and you're in an industry, right? I mean, I guess I would say you're in the fitness industry in a way,
for sure.
The rehabilitation part of it, at least.
Sure.
And that has to be both hard on you and hard on people that, especially you take a D1 athlete or just someone that's used to doing a daily activity they no longer can do, and then you've got to convince them to do what they need to do to get back to it. But I kind of wanted to jump back to like what got you into physical therapy. Like you're from the area here in Kentucky.
So I mean, I had an interesting route, or
because I'm sure there's people out there that would love to know that kind of that route.
So you know, when I was in high school, I had a chance to work in the medical field, working for a pharmacy. And through that, and it was cool because it was a privately owned pharmacy, so it wasn't like a chain like a Walgreens or a CVS or something like that. And I was able to see the private sector of the healthcare industry like firsthand. And I was just like, this is what I want to do. Like, I know that I would like to be in this setting, but I wasn't for sure. Like, I was just like, well, I don't want to be a pharmacist. Like, based off of like the day-to-day of what they did. I was just like, it doesn't fit me. It doesn't fit my personality. I'm too much of a people person. I like to interact.
They don't like you talking, right? I've heard they do not like you talking inside of a pharmacy.
Oh yeah, it's always like quiet.
Yeah,
and like
you're way too outgoing.
Yeah, exactly.
If you tried to go down that route, you would have been fired numerous times because you couldn't shut your mouth.
Probably, you know. And then, you know, I looked into, you know, like, okay, like what would medical school look like, or what would an MD look like? And I just knew a couple people within that realm, and I'm just like, they're just lifestyle. I just didn't like, you know, not so much what they do, but the fact
lack
of
life.
Like on call nonstop, or you know, the long hours if you are working in the hospital acute setting and stuff like that. And like, I've seen so many, I think, doctors and stuff like that they just don't seem like they advocate for health, but they're not like healthy individuals, you know. And I think everybody can relate to that. Like, oh, the cardiologist who's, you know, 80 pounds overweight telling you that you have to do something. And I'm making a very generalized statement with that. I'm not just, you know, like saying that.
But it is hard. Like, I mean, if you go to a dentist with messed up teeth,
correct,
it's really hard for you to get behind that dentist because you're like, this is the thing that you preach.
Correct.
But then you don't even follow what you're preaching, right?
Exactly.
Like, as a personal trainer for me, it's like if I just just did and ate whatever, never worked out, and I just coached people. Eventually, people are gonna be like, "Man, you look horrible. Like, why am I gonna pay you money?"
Exactly. And and so I was injured at some point. As a high school athlete, I ended up in PT, and I was just like, "Well, these guys, this is pretty sweet. Like, I could see myself doing this."
What kind of injury?
I think a sprained ankle playing basketball is what it was. Yeah. Nothing crazy. Been extremely fortunate as far as from an injury perspective. Like, no major right now. Surgical.
You keep trying to do these Ironmans or triathlons.
This is like a knock on wood statement, But so, like, nothing major from that sense, which a lot of people are drawn to PT through typically a major sports injury of some nature. Or I would say they have a family member from that a PT worked closely with, and whether that's like from a rehab perspective, oftentimes you'll see it from like people with heavy neurological conditions usually have a lot of PT. So whether that's a stroke or whether that's a traumatic brain injury, and maybe it's like a parent or something like that who's had that, and then they've seen the physical therapist work with their parents or work with that individual, and that's how people get, I would say, drawn into it. And so, mine was very similar in the sense I was drawn into it as like, this is what I like to do. I know I like to work with people. I like to be hands-on with it, and then I love the whole fitness, sports, as well as that type of thing. And it was just, it was I shouldn't say a perfect fit, but it was, and never really look back. The interesting part though with all that, when you go back to like I saying like, hey, tell people on how you did get into it. I also did, I did business administration for my undergraduate degree,
which is really helping you out in your current position right now.
Correct. But I knew that long term that I wanted to own my own PT practice was what I had in my head of what I wanted to do, and I'm basically where I'd like to be though. Like after like I work for a private company, and so I'm able to do a lot of things that you get from
you're the shot caller there.
Yeah, exactly. And so the undergraduate degree, you're correct. I use that more now from on a day-to-day basis.
It was, I guess what I was saying is a smart degree in the career path that you've taken.
And as much as we always you should be confident in what you want to do, like, and you say, and I think it's very
it shows.
It's right. Well, I think it's right too. Like when I say I'm going to be a PT, like at the end of the day, I was going to get to that. But from the requirements to be able to get into school and complete your board exams, it's not a given, like I'm confident in myself that I was going to do it and everything like that. But I also was just like, well, if I don't get into PT school, because of the competitive nature of it, well, I want a degree that like I can also apply and use, and so like a lot of people do like exercise science for their undergraduate degree and then go on to PT school, and there's nothing wrong with that. They do super, super well. But I've also know enough stories of people that like finish their exercise science degree, can't get into PT school just because of statistics and grades and stuff like that. And now it's just like, well, what are we going to do with this, outside? And so, personal training is one thing that those people go down to. But also I think going into PT and personal training, a lot of it marries and a lot of it's very much on different ends,
Oh, 100%.
And so that's kind of why I chose. I was like, hey, I'm going to do this. And then you can cover all your prerequisites in school for that, which meant, you're taking extra classes, extra hours and stuff like that. But at the end of the day, like, well worth it on 100, on all that kind of stuff. And then ended up going to PT school with UK. But UK has a satellite campus in Hazard, Kentucky. And so basically, yeah. So it's an awesome program. So the UK does actually, that I'm aware of, they have two of these types of programs. So for the physician's assistants program with UK, as well as the PT program, they have two satellite campus where the PA program's at Morehead and then the PT program's in Hazard. And it's all of UK's effort to promote rural clinicians. It's certainly lacking within our state. People that want to live in rural areas of Kentucky, practice medicine or practice, PT.
Well, the poor towns in this state are
just underserved.
Yeah,
completely underserved. And so, and they've done a great job at it. Like I can think of like from my class, we had 18 people in it, and I would say anywhere between 8 to 10 of them are still practicing in rural settings or stayed in that area,
fantastic.
you know? And so like, certainly I'm the person that it did not, but you know,
now you're living the big city life here in Lexington. Oh my gosh.
Yeah, big city Lexington. So, but you know, that experience with there in the smaller class, there's a professor down there by the name of Dr. Chuck Hazel, who's just phenomenal. I mean, out of this world, and you just get a lot of hands-on one-on-one experience because the class size is smaller there as opposed to here in Lexington where you have 65 to 70 students. And each campus, I would say, had their pros and cons.
What was the hardest part about PT school for you? What was like the most difficult or challenging thing that you had to overcome, you feel like?
You know, probably as far as like class stuff, neuro was by far the hardest subject for me. But then I would say the whole just time management type thing, more so of like I was good at my time management and that type of like I knew what I needed to get done.
Right.
The hard part is like, you know, on the weekends you'd spend the entire day studying, you know, on a Saturday, or you'd spend an entire, you know, you'd miss
discipline,
something, you know, because you're studying. You know, I didn't play a lot of golf when I was in PT
This guy
school.
loves golf, by the way.
Love it. So, so I think that's probably that was the hardest part.
Okay.
Was you know, missing out, but you know, and there's different sacrifices. A lot of my classmates too. I mean, I had classmates that were married, classmates that had kids. Like I can't imagine that side of things. I mean, as well. I mean, I didn't have any of that, which was I shouldn't say nice. Like that's not like maybe the right term.
Well,
it
makes
it
like easier because you don't have those extra distractions.
Your commitments are different.
Yeah.
Let's just put it that way on stuff. And then once I graduated, I was down at Elizabethtown at our E-Town clinic. I mean, it was fun. I had a great mentor down there, two of them actually, that I was able to learn a ton from. And I think that prepared me through a couple other, you know, I would say, you know, specific either like programs as a company that we have to come to Lexington, open the clinic, because it's like, this
is your PT Pro's first clinic in Lexington.
Correct.
Yeah,
correct. So I mean, so we've had multiple challenges like any startup business. I think you'll attest to that. You know, I mean,
you opened up like a week before everything shut down because of COVID.
Yeah, I mean that's
you were like,
you know, but the cool thing about it, David, is that like as a company though, and I think it attests to us as a whole as a company, is that we were in a position and ready for the challenge and had the right people in place to be able to take it on and the challenges that we face and are still facing. And that's and I think maybe that's what you'll even see. I'm not like this huge economist or huge anything, but I think that's what you'll see that will come out of this pandemic is like the resilience of companies are probably the ones that are well ran, people that are with the right staff or people that are in it and that type of stuff. And you know, some of the ones maybe that unfortunately that we'll lose during the pandemic and coming out of this are the ones that, you know, maybe weren't in the best position.
I think customer service is big right now after what people went through.
Yeah, 100%. So,
so what was like best part? I mean, so the
of PT school.
Yeah. Like what was the part that you're like, this, I love this class.
Yeah. Okay. So if we're going to go classes, gross anatomy is out of this world. Like amazing. Just, you know, I first off, you know, a major thank you. And they do a very nice thing of the people that donate their body to us. Okay. You know, when they do pass for us to study and learn from. And that's not just.
So you actually have cadavers you get too?
So we have actual cadavers that we get to actual dissect and learn from. And so what is it? There's so we actually had our own cadaver lab in Hazard. And so we had four cadavers that we got to dissect and learn from and everything like that. And then we had, I think in Lexington, I don't know how big theirs is. Because they share theirs as well, though, with like the medical. I don't know if they share at the medical school, but I think they share with maybe the dental school and maybe even the PA school. But don't quote me on that and stuff. I'm sure one of my Lexington colleague could probably speak more to that. But it's so cool. I mean, it's so cool. And it's one of those things that also makes you appreciate like and I apply this to like patients that I have now, is like how everybody's body is so different. So like,
oh yeah,
you know, like we have this cool idea, you know, that we have these cool diagrams or drawings or apps these days of like the human body, and it's just like, you know, this is where this nerve is, this is where this, you know, blood vessel is supposed to be, and this is where, you know, this you know, attachment is supposed to be, whether the muscle or size or like that type of stuff. I can't tell you the amount of like anatomical variance that we saw within and we just had 4 bodies, you know, like, so you want to talk about sample size. I mean, it's like, that's like nothing in the scientific world,
right?
You know, a sample size of 4 is like, means like, oh, that who knows what
still
that
a theory.
is. Yeah, exactly. So, you know, and so that class and what you learn in that class, and probably from a knowledge perspective of continual use,
so that information really
charts.
carried over to your day to day.
Yeah, I mean, there's not a single day that I do not use knowledge from that course. Yeah.
Well, every time I come in, you know, whatever we're working on, half the time you pull out that book, you're like, all right, these are the muscles we're working on.
Yeah, exactly.
Because, you know, I'm, you know, personal trainer, and I'm always trying to further my knowledge base.
Correct.
And I love that you're just like, I'm going to teach you if you'll learn.
And there's such a power, like you were saying, like, to say like, okay, these are the muscles we are working on,
right,
or like this is the structure that we're working on. There's so much power in visualization, and there's been studies
it helps people
done.
Maybe think about, oh, this is what my hamstring is.
Exactly.
I've not been firing this properly.
Exactly. There's studies upon studies of like visualization, even practice, and so this applies to even not just like maybe muscle activation, but like how important it is to lay in bed and visualize making a free throw, or laying in bed. And for me, it was golf. You know, I was constantly like, could you stop firing the left hip so quick? You know, like, and I'll think about it. You
played in college, right?
About it. I did. Yeah. So I got the chance to play for Morehead State. I wasn't good in college at golf,
but he was good enough to play for Morehead State. Better than I was at golf. For sure.
Yeah. And it taught me a lot, and like stuff like that.
Best
I think
game.
like sports in general teaches you a lot.
Right.
You know.
What was your best score? Like legitimate, like.
It was 65 in a tournament. So.
I mean, that's 7 under par. So
yeah,
I
it was
mean,
good. It was good.
That's pretty good.
It was a good day on the course, but yeah, I mean, it's what were we talking about? I guess gross anatomy. Yeah. That was awesome.
Just sidetrack him with golf real quick.
That's right. We can get back to golf.
He's more than happy to spend the next 2 hours on just golf alone. Screw the PT thing. Let's just talk golf.
Exactly. And then the, you know, because we were such a small class size, like the outside perspective or the outside thing from PT school was the relationships that you have, you know, and the friends and like that type of stuff. Like you just can't. You spend so much time.
Do you still keep up with quite a few people?
Yeah, I still do. I mean, it's one of those things of, you know, as life goes on and everybody gets busy, like I wish either you saw the people more, or you talked to them more, and like stuff like that. But I mean, I still check in with my core group of friends and like stuff like that.
People from school that you guys can talk about like ideas or thoughts, or like, like I'm having this person.
Yep.
I don't know what information you can give another PT individual. But enough, hopefully, for them to break it down, and you guys can maybe discuss a solution together.
Totally, yeah, no, totally have bounced ideas off of you know, other classmates and stuff like that. And you know, and the nice part about that is like we went through the educational process together, and so it's almost like, hey, do you remember like in this lab with XYZ, you know, teacher, they talked about this, or you know, I've had other, you know, people reach out, or I've reached out about like, hey, like, you know, I can't find this material, like literature that talks about whatever condition you might be doing. Like, you mind sending it over to me, and like stuff like that. Yeah. So, I mean, it's always a nice resource. I think bouncing ideas off of colleagues in whatever field you're in is important, you know, and not thinking, if you think that you know it all, I mean,
I do know it all.
Exactly. Right.
I don't think it. I know it. If you know that you know it all, then you're okay. It's when you think that you know it all that you're totally screwed.
Exactly. No. So I mean, it's it was it's one of those things though. Like I would not want to go back.
Right.
So
what are,
in the sense of like having to go through all the study?
Oh my gosh, I wouldn't want to go back through through studying to become a personal trainer again. And
exactly.
Like that, you jam so much information into your head in such a small amount of time. And the worst part is you kind of stay stressed, like a little bit of stress in the back of your head, like until you complete.
Yeah, 100%.
Like down to the day that you got to take that damn test to get your certification or your license. So there's a relief when you walk away from it.
Oh yeah, 100%, 100%. And that's why, like, going back to school I'd struggle going back to school for anything in that sense. Like we continue to learn and like take courses and like all that kind of stuff, but that's different. That's completely different than like saying like, hey, so just so you know, like if you ever want to like do this that you've just done into school, like you have to pass this exam. I mean, the same as for you. Like you had to pass that exam. We have to pass, a national accreditation exam.
This guy was worried that he did bad on his exam and found out he killed it.
Yeah. It was, it's not fun waiting and stuff like that, but it all worked out for the best.
So what are some of the most challenging things you deal with day to day as a PT that like is hard to overcome or you've learned to overcome? Like, I'm sure some people would love some knowledge drop here on ways to communicate with people or specific injuries that you constantly have to deal with over and over again.
So I think if you're going to say like from a challenging perspective, is we see in the clinic, you see the chronic pain patients, and those can be easily though the most rewarding patients, and they can also be the hardest patients, and typically that's from a sense of there's a lot to figure out with them, and there's a lot of levels. I think of it as like from an onion perspective of like to
how many of those people do you think how many of those people do you think like the chronic pain is more mental to them than it is actual, like physically, versus like people that genuinely are. Yeah. Because I do feel like there's people that like have a little bit of pain and they turn it into a lot of bit of pain in their head.
Yeah, correct.
And they could overcome it if they wanted to.
Kind of like a catastrophizer, but so.
Or maybe they just don't have the willpower to fight through it.
Yeah, so I think to say that like those types of patients don't have pain, I think is incorrect. I think that they truly are experiencing pain and those types of things. And that's the really tough part about just pain in general, is that it's semi-subjective, because what's painful to you maybe not is painful to me, which is not painful to the next person. But with that being said, I don't think those patients, when they come into me, they're not making it up.
Well, of course.
So they're not like making up like, oh, it just hurts.
Like, like my knee hurts. Like I'll do something to upset it. It hurts. Exactly. But I've just learned to be like, all right, I've got this pain. I got things I got to do. I'm not going to let this be debilitating, but I'm also going to work on trying to fix it.
And I think always what I try to remember with those patients is that, I mean, their pain started at some point.
Right.
And it's not like when you get into those type of situations, those people, it's not like they wake up like 30 days ago and are in this massive amounts of chronic pain. So like they've been dealing with a discomfort, like your knee hurts and you've been dealing with it and stuff like that. And let's just say like, you just didn't get treatment for it, or you didn't seek help for it, but it wasn't enough to stop you from going to work, doing your daily activities and those types of things.
But it was always annoying me.
But it was always annoying you. It was always annoying you. It's always annoying you. And so then it's kind of like, so now it's been going on for like 20 years, and now it's really hurting you and you can barely walk.
Right.
And so it's just like, well, so like I think that's more so where those patients come from, is that like they have a little bit of back pain. They don't address it. They don't make lifestyle changes. And those lifestyle changes could be anything from, yes, they need physical, strengthening and those types of things, to like weight loss, or like a mental healthy lifestyle change of like proper amounts of sleep or proper diet and those types of things. And so like now our body is not in, let's just say, call it like the most optimal state.
Right.
And so now we perceive maybe pain as exacerbating, or it's like your nervous system, we could say, is like upregulated because we're not in a healthy state. And so then it like hurts way, way worse maybe than what it maybe would if we were in a healthy state.
Where would you say your percentage lies as far as how many athletic type people you're helping recovery and rehab versus your everyday individual, your 9 to 5 person that Well, I guess there are people that are going to be there athletically that are 9 to 5 too, but
Yeah.
you're non gym goers almost,
Yeah,
right?
no,
You're
no,
not
that
fitness
makes
people.
sense. Yeah, and so honestly, I'd say it's more so like your gym athletic population, and in your caseload, I would say varies. Sometimes it's maybe 20%, sometimes it's 10%. So I would say it's more so a smaller number sometimes than
Right.
what you think of, and certainly like initially, like I thought, like, oh, those are the only people I want to work with.
Are they
the
easier
athletes.
to work with or more difficult to work with?
Ooh, man, that's one of those, like,
because you get those gym
depends.
people that think
Yeah,
they know everything.
exactly.
Like myself, I come in, I'm like, let me tell you how you're going to rehab me.
Yeah, exactly. and so it's one of those deals where the some of my most challenging patients have been people that are like really, really in tune with their body.
Okay.
And that I think is a good thing in the sense as it pushes me as a clinician, to really, whether that's from an explanation standpoint,
right,
or creating buy-in with that patient standpoint, or coming up with, the exercise or the intervention or the plan of care that's going to help that individual. And so, somebody comes into you and let's just say they're like an elite endurance runner, okay, whether it's they're a marathon trainer or they're training for Tough Mudders or they're training for triathlon stuff, and there's like, everything feels great except like when I get to mile like 7 or 8, like I start having like some pain in my right knee, and it doesn't allow me.
You have people come in for something that specific.
Well, and it doesn't allow me to like push past this. This. Yeah. Well, I mean, I had a patient like this. Like, this is an example of a patient, and so like that's hard. Okay. I mean, what
if you can talk about what you end up doing to help the patient overcome that challenge?
It was kind of more so figuring out. Okay, so what's going on when for whatever reason, once the body has been under stress for, let's call it an hour to an hour and a half, right, doing a repetitive thing, like what's happening? What is it? Is it your running mechanics are like breaking down, and like we start
like
changing,
bad form almost?
Yeah, so like we start changing the way we run because of like a fatigue factor. Is it a tissue more so stress intolerance? So like the tissue, yes, it's able to, all of our tissues have like an elastic recoil kind of property to them, and let's just say like maybe that starts breaking down, and it's kind of like you reach this breaking point of like it doesn't tolerate it anymore, or is it just simply, there's other things within the body that are just like I don't know how to explain this, right, like your body just doesn't tolerate this, like I don't, and like this individual, it was more so like a fatigue type thing, kind of got some sloppy form that we were able to address and like say like, okay, whenever you hit this point, like you just need to be conscious and thinking about, X, Y, and Z in your running form, or
right,
gait
push
pattern,
through, but be conscious of the form so that you can continue to have.
And so like patients like that, that's tough. That's like let's just if we were to take like personal training for an example, and someone was just like, I'm spending 5 hours in the day right now, and this is my diet, which is like completely, let's just call it perfect to a degree,
right,
okay, and I'm sitting at like 4% body fat, and the person's chiseled, but there's like, my goal is to get down to like 2% or something like that,
right.
Well, that's hard. It's like, what are you going to bring to the table from like an educational standpoint that this patient doesn't have? And you might not, and that's the thing I think with difficult patients or difficult clients, is that very rarely do you find the answer to the puzzle on day one.
Oh yeah.
So that's the thing that
it's an ongoing.
Correct.
You're constantly adding pieces to that puzzle,
but you have to create buy-in. So the thing is if you want to fix this patient, you also need to be able to see him for a couple of times to be able to figure it all out. And sometimes that's not what people want to hear. We're an instantaneous gratification society where, by golly, if I go in and see you, like I want to know the answer now, and you should fix me now.
And it does not happen like that. No, I've got a client right now that I'm working with that has some knee issues, some weight issues, but man, she has the best attitude And she's committed. Like I've even made comments, but she is committed to like she expects to be working with me a year from now. Like she understands that the challenges that we have to overcome, like we're just trying to overcome challenges so that she could actually start lifting.
Yeah.
So right now we're working on range of motion. We're working on better eating habits, better overall habits throughout the week on like when we exercise.
Yep.
Next week I told her she doesn't eat a lot of fast food out, but at least once or twice a week.
Yep.
So starting Monday, I told her you can't eat any fast food for a whole week. I'm like, if you want to go to a sit-down restaurant, that's fine, but you better be ordering a salad and like grilled chicken or something, something healthy there.
Yep.
But the thing that excites me most is that she has such a great attitude, and she's very aware that this problem is going to take her years maybe to get her to where she needs to be at. But she's already seen the progress, like where she's gotten in the last 3 months with me. The weight loss that she's had, her doctors are like, talking about taking her off certain medicines maybe because her like blood sugar's gone down, and like, so she's making these changes, she's seeing results, and she's already committed for the long term. So if you can get people to do that,
and that helps create. That helps create buy-in, and as soon as you can start seeing results and stuff like that, that instantaneous buy-in, it does take place, and that's important, and that's creating that with any patient. Like that's the challenge, and that's also the like why I like what I do, is because creating buy-in for one patient is framing it in a certain perspective, while creating it for another patient is completely different.
Right.
And cracking that code is more so. That's more so like an interpersonal skill. That's a relationship building skill. That's
communication.
That's not like a knowledge based skill. That's not. PT school doesn't. They tell you to create buy-in with your patients, and that's kind of like, well, great. It's like anything. It sounds great on paper. Right. Okay, like do that.
Well, you created your buy-in with me when it was action more than it was verbal, because when I came in, anything you said, how good or how you're going to help me, was not going to convince me unless I physically saw that there was action, right?
Yeah. And
and I did, for the most part, what you needed me to do. And I've seen you twice a week, I think, when I first started coming in.
Every bit of that,
and I started seeing changes. Yep. And I also saw that you were like, every time I came in, you were prepared. You were ready to be like, all right, we're going to work on this knee some more. And so it made me feel safe and comfortable, and that like, I was like, at least this guy is making an effort. This is where I have to go. And then over time, after seeing you for as long as I have, it's like I started seeing my knee get better. I went from hobbling, couldn't even jog, to being able to run again. And so it's been such a gratifying journey. But yeah, I guess in a way, if you hadn't built that buy-in by just showing me how you're going to help me, and then me feeling the difference, I very well could have just stopped coming.
Yeah. And and I think the biggest thing, in creating the buy-in is, very rarely is it like an instantaneous, especially when the body, the medicine that we're practicing in physical therapy is we're trying to let the body heal itself.
Right.
And so, which I think is the most sustainable healing, in the sense of like the long-term effects, or like it will be like, that's something that you can last a lifetime or last a long period of time.
It's building
not
those habits
fast,
too.
Though, the body can only work so fast. I think one of the things I tell patients is like, if you came in with this problem that's been plaguing you for years, it's not going to go away in a day.
Right.
And they understand that. And I think when you frame that with a patient and tell them that, then it's like, listen,
realistic.
I'm not going to sugarcoat this for you. This is, it's going to take time. It takes time to make changes within the body.
I keep trying to get Ian to say, David, you're good to go. Go play basketball. And he refuses to give me the green light, and just gives me a look anytime I mention basketball. Like, I can't stop you, but I'm going to be so mad at you if you come in with a messed up knee because you went and played basketball.
I went to the YMCA, and there were these 12-year-olds. I went to dunk on them.
And then my knee broke again.
Well, that was your goal. That was your goal. I'll never forget that. You came in and you're just like, I was just like, hey, like, what's our goals for therapy? Like, what do you want to get out of this? And you look, you were, the best part was you're just dead honest too, though. You looked at me and was like, I want to dunk. And I was just like, okay.
those goals
we'll
are
there.
we'll work towards it.
We'll put that one on the back burner. Let's work on these ones first.
So I'm definitely not dunking.
I think
but
that's more.
I'm jumping again.
Exactly.
I couldn't even jump. I couldn't even do a box jump. Like so
I think it's morphed a little bit, our goals, which is
I think I might have matured some and realized that like maybe I need to stop doing these things and hurting myself. That sometimes goals are actually not good for you. Certain goals are not the best thing for you.
When on day one, you just listen. You say, okay, we'll work towards that one.
Yeah.
And you just let it roll and stuff like that. So, but yeah, it's fun. It really is.
Yeah. I mean, I've enjoyed coming to you over the years, and that's why I had to bring you on for the podcast, because I just like, this guy knows fitness. This guy loves fitness. This guy fixes people. We gotta talk about it.
Yeah.
So, do you make up many of your exercise? Like, where do you pull out of your, because
we call it the exercise bank.
Yeah. I mean, the exercise bank, or when someone really comes at you with something, you're like, I've got to research that. I mean, do you get a chance to actually try to come up understanding how a muscle works, or a ligament, or a joint?
I'd say so. It's twofold. It's one, I do make up a lot of exercises.
Okay.
To a degree, I guess you could call it making it up. Not in the sense of
or there's all the little pieces, and you put the pieces together to make up
exactly
of things that this works and this works, but when you put these together, now we're getting this.
And understanding, I mean, when it comes to exercises, like what is the function of the exercise?
Right.
I think, and that's when it comes to like, saying I'm going to make the exercise up. I'm more so, it's like you come from this knowledge of like, okay, like what muscle or what structure are we trying to target within the body? And then with that, we know just more so from an educational standpoint of like how that structure or how that muscle works. And so then by putting the joint or putting the patient or the person in a certain position, we know that like it's going to stress that in a certain way. And so kind of more so like that's what I use from like a framework, I guess you could say. And then once we know like, okay, this is the muscle or this is the area that we're targeting, I mean, then it truly is like the what you can do is endless or infinite as far as the number of different exercises that you can do. And it's so fun though, you can take let's say a simple exercise like a curl or let's say a shoulder press, and by changing just the slightest thing in either body position or what you are also like you put in combination movements with that,
something dynamic,
and how much like then higher level things can progress to, and so it's part of one of those things of I mean. And I would say that we call it in therapy like parameters. You change the parameters of like either what they're standing on, what they're sitting on, if we're stepping and doing something.
Right. So different ways of stabilizing them or
correct.
Putting them unstable.
Correct.
So that they become more stable.
And so it's just like, okay, like you're strong and you're, again, it's just a simple concept that everybody knows of a bicep curl, but now you start changing where the trunk is positionally. Well, then the shoulder has to stabilize to still be able to do the bicep curl in a proper manner. Well, the systems now that we're involving within our exercises, I would argue, become way more functional because just like you're sharing with me about stepping and like our knee bothering us.
Yeah.
Well, you're using an entire system when you're stepping and moving and doing things instead of like just doing. It's not like you just needed your quad to activate and stuff. It's everything from the core needs to be stable, okay, and your obliques need to be stable. So as you're laterally stepping, like you're not leaning way outside of your base of support. Well, then also all the adductors, the quads, hamstrings also all have to fire. And so
I thought they were firing until my knee decided to started giving me problems again. It's like I sprain it every 4 or 5 days now.
Yeah, and so when it comes to like going back to like making exercises up, I mean, I think about more so like how can we challenge more systems within the specific
so you're a big fan of functional movement.
To do. Yeah, I'm a huge fan of it, and
which I don't think enough people are. Enough people focus on certain things, but they don't focus on overall like just basic everyday range of motion and movement.
And I use that though, like I use that across the board from like, I mean, I would consider you like a high level individual, like, you know, athlete that I'm treating, to Miss Betty Sue, who's, you know, we're just a fall risk. You know, we're just trying not to fall in the bathroom, or we're just trying to like be able to reach up overhead to grab something out of the kitchen counter. Well, who's to say that Miss Betty Sue also has a cat, you know, that gets around her feet when she's trying to reach. So if all I do is work on shoulder range of motion and strength so she can reach overhead, okay, well, that's really, really nice, but is that functional? Like, does that apply to her life? And I would argue no, and we're just
lower body,
skipping,
and core might help more.
But and that's I mean, it's one of those things of like, well, yes, we need to work on the range of motion, and like she needs to be able to like do things as far as like that's concerned. And so like, yes, you're going to start and just work simple exercises of stretching, of manually stretching them or doing things like that. But you need to at some point progress them or get them into a functional state. And so that's kind of where I would say I pull with my exercises.
How do you progress people that really are never ready for progression? Because in my opinion, seeing you once a week, and then that's all they do, it is so hard for them to progress off one exercise session with you a week or one PT session with you a week.
That is tough. I mean, that's like one of those things though of I don't know if I have the answer for that. I think it's a good question. It's kind of
it has to be frustrating because their insurance or whatever, they just keep paying money for something that like in the long run just isn't going to fix them or isn't going to get them further along in recovery.
Well, and that's like, I mean, I could get on a whole soapbox with like insurance benefits and like limiting people in their progression with therapy. Just because like in a perfect
world, we're going to have you back on for another podcast just to bash the insurance world. Just to bash the insurance
Basically,
world.
We got people behind screens telling people what they need. They've never seen the patient.
I saw there was a meme, and it was like a little video, and it was pretty much like the real doctors are the insurance people because they're the ones that actually make the decision. If the real doctor's like, he needs this procedure, and the insurance company's like,
we're not going to approve.
We're not going to approve that. Like, wait a minute, who's the the person behind the computer screen, or the actual physician that spent 8 to 10 years in schooling to be able to make this diagnosis.
Exactly. And it truly is. There is a checks and balance system, so that like clinicians or providers don't overspend. Because the other thing you just got to remember, we're going down a rabbit hole here, but we don't have.
That's why we're gonna have a whole nother podcast for this.
We don't have infinite resources either.
Right.
Is the other thing. It's not like. It'd be a great fine and dandy. Like everybody should be able to come to therapy and do stuff as much as they want. Well, somebody has to foot the bill,
right?
I mean, there's only so many resources, and so that's why you have the checks and balances. It just can be frustrating, no doubt, when like you have somebody that would benefit from more therapy, and it's just it's one of those things like just because the insurance plan that they selected at the start of the year is going to limit that,
so
and they didn't know that.
Like one of the special things that you do that I am a huge fan of, and I don't think a lot of people out there probably tried it. I feel like it's kind of new, is the needling, right? The dry needling.
Yeah, I would say it is relatively new. At the same time, it is like I would say like a hot treatment topic. Or
I feel like it definitely added relief.
Yeah, it is.
It worked.
It's something that I've seen great results with certain people. It's also one of those things where like,
is that usually an extra with the insurance companies, or is that usually
it depends from one to the next.
Okay, so really like with the VA, you're able to do it on me under whatever insurance. Okay,
and so the with dry needling, it's one of those things that like everybody that walks through the door isn't getting needles stuck in them.
Some people don't like needles.
Yeah, exactly. And even like as we learned like about dry needling, like the course that I took to be able to certify to be able to do it, like the one of the things that they said was like, if somebody is just like petrified of needles and like super hesitant and like that type of stuff, it's like, don't do it with them, just because the response that you're trying to get, as soon as you're going to get the needle close to somebody, like they're naturally going to like tense up,
and that's exactly what.
And like that's like almost like the opposite of what you want. want to be done.
Have you ever had a needle just stick in there forever? Because I've done it enough now with you that I know that like sometimes my muscle won't give it to you.
Yeah, exactly.
And you've got to sit there and like wait another 5 minutes for the muscle to like. So have you ever had one where you're just like, or do you just force it out eventually?
Well, there's a couple other things that like if the muscle doesn't want to release it, that you can do to basically
like,
kind of trick it in.
Have you like added? I feel like one time you might have added needles to like.
Yeah, so like you basically like the area around it, you insert another one.
So your leg won't give the needle back. So let me put like 3 more needles in you because that's totally gonna fix the issue. I do
with patients. Only with patients I trust.
But the dry needling, I mean, I noticed relief pretty much, right after doing it.
It really, it's one of those things too. Like, we still don't understand maybe everything exactly on why it gives people relief, but clearly it does. And there's certain studies that have came out.
The thought process is that it gives the brain another thing to attack, right? Like it sees the needle and it almost is like, oh, let me not worry about this so much where you've got that tension in your knee.
Correct.
Let me worry about these needles in here.
Yeah, I think that's a good way to look at it. I really do. I think I don't think I need to like correct anything that you said. Like that's a very realistic way to think about it. And like the the results that we have seen with it is just good, and I use it everything from like with you, the knee, to back patients, to cervical patients, to forearm patients, to
I'm a big advocate of
it. Patients. Yeah.
So anybody out there that's watching this or listening to this and is thinking about getting dry needling and thinks they can handle the needle, and your PT or doctor, whoever is suggesting that you try it, I 100% think that you should attempt it.
I think so, and I think that I mean, at the end of the day, too, like I've never like had somebody come back to me and they're just like, I never want that done again, or like I hate you, like I couldn't move for.
But I'm sure you had some people being like, okay, I tried that.
Yeah, I tried it.
I don't like the needles.
Yeah, it didn't really work, and I was like, okay, that's fine. I'm like, no worries. And I think it's one of those things that's more so like a toolbox and stuff like that. I should say a toolbox. It's a tool in the toolbox when it comes to treating people, because there's plenty of people that get the exact same results with individuals and patients who do not dry needle. And those patients do well too. So it's more so kind of like what's going to be maybe the best course of care, and that's just clinical decision making.
Do you have any other, I guess, side certifications or?
No, not.
Is that the?
That's
outside of your basic PT certifications.
Yeah, no, I'm with you. Yep, no, that's it. The other like common ones, like so, like I've done training in these other. I guess you could say side certifications that you can do, which is like there's a Maitland certification that you can get, which is more so just like a school of thought within the PT world. There's a Mckenzie certification is what they call it, and again, that's a school of thought within the PT world of like how you treat patients.
Okay.
And then I'd say like the other like I'd say big ones that people also get. There's an OCS, which is an orthopedic certified specialist.
Okay.
And that requires a test that you have to take, and it's more so it's like you study for this test, you sit for this exam, and I want to say it's it's like 200 questions or something like that.
Oh wow, so it's pretty.
Yeah, it's pretty extensive and stuff like that, and you sit down, you take it.
Are you planning to work on any of those?
Yeah, I think I'll do OCS, and we have somebody within our company, actually 2 people within our company that are OCS certified and stuff like that.
Oh, so it's not super common that the PTs have that.
I would say yes and no. There's certain companies that like say if you're with us for X amount of years, like we want you to work towards getting OCS certified. Okay. It's like one of those certifications. It's I think it's good to further yourself and stuff like that, but it also doesn't mean you're going to be a good PT either. Right. It's like letters after your name kind of
right. But
of like,
I think a good PT gets those certifications,
correct,
puts them into practice, and utilizes them.
Correct.
Instead of just like you said, having that like, I can dry needle. Yeah. Well, how often do you dry needle? Well, I don't really dry needle. I can do it though. I'm certified. Yep. But if you're not putting that tool to use,
and then like it's interesting. Like the PT world has also done like this. Like almost like a board certified type specializations that you can do, that you have to do like a residency program with. So this is after PT school.
Okay.
That you go and you do this. And you know, it's the sad part is like, as a profession, it's like those clinicians are valuable, and they're really probably good at what they do, but we don't see, there's been no catch up as far as from like a pay rate increase if you're XYZ specialist. I mean they'll ask for it and stuff like that, and certain companies will, but it's not like you could say, like, let's just say you're you're a sport athlete, and you're going to go to like a sports board certified specialist PT or something like that. It's not like the insurance company is going to look at it like, oh, they're going to this specialist, we're going to pay them more because they're seeing.
So PTs that go get this stuff in theory are really trying to be better PTs, because it doesn't necessarily.
Correct.
It furthers the career personally,
correct,
but it doesn't further it financially as much.
Well, and it also, it's going to further it. Well, I mean, yes and no. The other thing is that if you do get like this specialization potentially, it also might guarantee or give you the opportunity to work with a very specific patient population. And so maybe if you get the sports one,
you're interested in,
or like the there's neurological based ones as well, and that is your passion, that's all you want to work with, is like this type of neuro patient.
Right.
Well then, yeah, like that's going to get you to where you want to be in your career path and stuff like that. So there certainly are benefits from it. Those PTs that are, I mean, certainly have a leg up when it comes to a specific patient population that they're treating. It's just one of those things too. It's more schooling and more of this, and it's kind of one of those, you weigh kind of the cost benefits of like, is it worth it for me to do this as well, you know, and invest all this time as well as.
So why'd you decide to get the dry needling certification?
Just, it's something that I could use tangibly within the clinic.
Man, I'm happy you got it.
Yeah, and it's different. Like that type of certification is different than like what I had been speaking to, in the sense of like those stuff is like, that's like a year-long process. I mean, the dry needling stuff, you can be certified within like a weekend course to be able to do it. Yeah, so
I'm gonna go get certified then.
Yeah, check it out.
Do you actually have to have some kind of medical degree or something?
I think so. I mean, I can't speak, but I think you do.
I would hope so.
I would.
I wouldn't want me dry needling people after a weekend. I mean, to be honest.
So I think that you do, and I think like, because I know, like for example, I think, you know, like chiropractors can be dry needling certified and stuff like that, and I mean, because they have the clinical background or the.
Well, I feel like you need to have a good understanding of anatomy, right? Yeah, and I have an understanding of anatomy, but I don't have it memorized. I'm still working and learning.
It comes down to probably more so that.
I mean, your anatomy class is probably as long as my whole certification class.
Yeah. So. But you know, it's within our company, we try to have like at every single location somebody that can dry needle and stuff like that. And so like
PT Pro as a whole likes that, like they're proponent of it as a company.
Yeah, and you know, just because we've seen we've seen the results from it and stuff like that. And so again though, it's one of those things of like, if you're a physical therapist and that's all you do with all of your patients, well, I would be skeptical of that as well.
Right.
So yeah.
Awesome. So what, I guess just going back to some basic, like when you think of patients, what are some of the things that you think people, just as a whole, not even necessarily patients, things that people need to be working on that they don't work on, that gives them, like what is one thing that people could be doing on a daily basis for their bodybuilder to just a regular Joe Schmo, that would give them the largest benefit, in your opinion? Like is that like? So
yeah, no, that makes sense. Okay, so I think it's twofold. Okay. I think it's I think movement is key. So I think that whether you're a bodybuilder or whether you're somebody that, you know, sits at a computer desk all day, or somebody that is super, super active as an athlete or something like that. I think moving your entire body throughout the day to its end ranges is like super, super key.
So are you talking like working on range of motion, like stretching? Or?
Yeah, and I wouldn't even call it like stretching. Like you got to like hold this and like stretch it and be miserably stretching it and stuff like that. But I think it's as different as like standing up and like back bending as far as you can possibly go to really, because if you sit all day, your spine is in the flex position all day long.
Getting that functional movement to its full extent.
Yeah. Or it's like, it's as simple as like, okay, today, do you think you turned your neck to the right as far as it could possibly go today? Yeah.
I have now.
Well, there you go.
I'm going to do it on the left real quick.
Yeah. And so like it can be as simply as doing that with all of your joints.
So is that like a routine people can be doing when they get out of bed in the morning? Or is this something they need to do throughout the day?
So here it is. So that's one of those things of like whatever works for you.
Okay.
If your routine is I got to get out of bed and I got to do that and stuff like that, well, okay, that's great. If your routine is like throughout the day, I'm getting my shoulders up and overhead.
So just throughout the day,
times.
just doing different things from your
different movements,
lower body to upper body to neck,
and taking it to end range.
Yeah.
Like not just like a little here, a little there. Kind of like you said, like rotating my neck all the way back, looking all the way up with my neck and stuff like
that. My stepdad does that. I'll be walking in. He has an office at the house, and I'll walk in. He's always doing some kind of bendy thing.
Yeah.
And I wouldn't necessarily call it stretching.
Correct.
But I would call it like just functional movement, or like just being able to, like you said, like sometimes I'll see him just bending his back. And, But he's always been like super mobile. As he's gotten older, he's just stayed so mobile.
Well, and that's probably a testament to that to a degree, just because like. The body is one of those things where it's like the mind. It's like anything. If you don't use it, you lose it.
Right.
So if you don't use your shoulder into like full reaching behind you, horizontal abduction. Well, when you go to do that, let's say you haven't done it in a couple weeks. Well, you go to do that to grab your purse out of the back seat and then pull it forward. And wow, that's when I tore my rotator cuff. Well, those muscles in those rotator cuffs, they haven't been in that position for 3 weeks, and now we're going to expect them to grab something out of the back seat and do it.
So something as small as just practice or just doing that rotation every day,
correct,
throughout the day, and get your body used to that movement,
being in that position, and being able to like fire the muscles in that position, the tendons being able to tolerate the stretch in that position. So I think that's like if we're going to go to the root of that question, like that, like everybody can do that, probably everybody doesn't do, or like that type of stuff. It's as simple as that. And it sounds super, super simple because it really is super, super simple.
But you've got to be mindful enough to do it.
Well, and I just bet you, like, have you turned your neck all the way to the thing? Well, no, I haven't done that.
How many people? And what was the average? 2.5, 3 hours a day on watching TV, or
like that,
like or scrolling. Like, how hard is it to sit there? And I do this. There are days that I just don't get around to stretching the way I like to stretch every day. I try to put 20 to 30 minutes of actual functional stretching in. And some days I'll be 8, 9 o'clock at night, maybe a little bit later before I go to bed. I'm watching like some TV before bed, and I sit and I think, man, I haven't stretched today. The next thing I know, I'm like, I can watch TV and stretch at the same time. Like,
I know.
Like this is not like, and honestly, the few times I've done it's been great because it like releases something to where like I'm way more ready, like relaxed and ready for bed once I finish that stretching routine.
Correct.
And I don't do stretching to the point that it's getting my heart rate up that high. And I don't stretch to the point of like, I think some people try to push past pain when stretching. Mm-hmm. I try to get to the full range of motion and then breathe through just a tiny bit more. Yeah. And I do that every day, and over time I get more and more. Well, I mean, we even go back to knees. You honestly didn't think I was ever going to get full range of motion in my left knee.
Correct.
Because of your experience and how other people have done. And I was doing what you were having me do, and I don't know if anybody out there has heard of this knees over toes guy. I picked up a couple of his exercises,
and you were diligent with that. And that matters. And
between your exercises and his exercises, and 2 or 3 months of doing that, we got my knee up to the lowest point of range, like the lowest maximal point of range of motion that we never thought we'd get to. And we got my good knee even further by doing that, which, again, goes back to consistency. So our co-host is not happy that he's forced to run around the background in the backyard without anybody hanging out with him. But yeah, so again, I think that going back to if you have, especially if you have a PT and he's telling you to do something, be diligent with what he tells you to do.
Of course.
He's not telling you to do something and not expecting a result. But you can expect no result from not doing anything.
Correct. And, and I think one of the things that I try to do with, my patients is give them something that's feasible as well. And so like, what is, if I were to give somebody a 10 exercises to do that's now going to take them 30 or 40 minutes. And let's just say this person hasn't been doing anything.
Right.
Are you going to really expect somebody like that for the first day to be like, oh, I'm going to
I would be disappointed if I didn't get a 45-minute workout.
40 minute. Well, yeah. But that's just and that's reading people though, in the sense of like,
100%.
Like, listen, just
baby steps, right?
Do activate this muscle for me 3 times a day, as well as stretch this, and do it consistently throughout the day, and we'll see some results and stuff like that. So that's how I treat patients initially, because you just can't expect people to like, they haven't been doing any of it, and then now to add 45 minutes into their day.
Now, do you over time try to increase that? So you start them out with like 2 exercises a week, and they get in the routine of doing that, and they've finally gotten it good. They have good form. They're doing what you tell them to. All right, 3 weeks in, let's add a 3rd or 4th exercise to go along with it.
Sometimes no.
Okay.
I mean, sometimes I'll add a different exercise in with it, but I'll then take the
Unless
ones
you got
away.
Someone like me who's like, hey, I need more exercise.
Yeah, no. And those, and those,
like, I need more.
And those people will tell you that. The other people and stuff like that, they don't have, I'm going to say they don't have time to add that into their day, but that's an unrealistic expectation. And that would be like, let's just say if someone, I was starting to learn, I was like, I want to learn to play the guitar, and go take a lesson from a guy, and he's just like, hey, like, these are the 3 chords you're gonna work on, and then come back, and maybe like I want to learn the guitar, and I got like 15 minutes a day to be able to spend on to like try to learn the guitar. Well, how realistic is it if I would go to a guitar instructor and I'm working 40 hours a week, and I have a couple other things going on, and he's just like, well, I expect you to practice an hour and a half.
But there's a lot of people out there
fuck
that the only thing they're committed to, and they're barely committed to that, is their 9-to-5 job.
Yeah.
And then they do, in my opinion, they don't utilize their time as wisely as I would like to. I personally utilize my time.
Correct. Right? No, correct. And that, I mean, that gets into a deeper conversation.
Right.
Like, are just people lazy? I mean, I can also get on a soapbox on that. But, and that's why I don't.
But that's part of your job, is to inspire people to not be that person, if you can, right?
But if they come to me and our goal is something simple, like I'm not. My job, I'm not supposed to be their life coach and like have them completely switch their personality or their routine. I'm gonna try to encourage them and give them the opportunity and do it like little by little.
Right.
But I don't hit them in the face day one. Be like, oh well, you need to start doing this, and this. It's kind of like the people that go to the doctor, and the doctor's like, well, you need to lose 20 pounds.
It's not PT Pros boot camp.
Yeah, exactly. And you need to lose 20 pounds, and it's just like. Well, it's super simple to tell people, okay, yeah, well, you need to lose 20 pounds.
But you got to teach them, coach them.
Yeah, correct. And if you were to start 1,000,000 miles an hour with people, like, that just doesn't work.
Right.
It just doesn't work. So, so I think that, going back to the question of like, what can you do? It's that it's range of motion to end ranges and stuff like that.
You think is the most beneficial daily thing anybody can do.
And then the other thing that more so, this goes into more so for people that are just like, hey, how do I get active? How do I do stuff?
Right.
Honestly, it's a 15-minute walk. That's a
really?
Meaningful walk.
15 minutes.
Not like a I'm going to go out and, I walked today. I walked for 15 minutes.
Right.
I went grocery shopping. No, I'm talking like, put your shoes on. If you want to listen to your iPod.
Have a decent pace.
And walk on your sidewalk for 15 minutes. And that's just a great starting point. It's so simple. You think like, but if I guarantee it, if you weren't doing that right now and you were to do it 5 out of 7 days, and kind of do a little then like reflection from, did I do this week? Did I not do this week? How am I feeling at the end of the week? I would bet you that you would feel a lot better.
Right.
Not healed. Okay. Like
right.
let's be realistic here, unrealistic expectation. But you would just be like, oh, I feel better.
This dog of yours is killing me right now.
Super hard. Yeah, no.
Keenan,
he's it's
Keenan,
getting late. It's getting late for him.
Our host, DJ, he's been going over the dog like every 2 seconds to like get the dog to
I mean, Keenan, if you want to bring him in here in my lap, I can let him chill here for just a second.
I'm sure people would not have a problem seeing your dog.
as we work on wrapping stuff up.
Yeah, you can bring him in. Oh, well, I mean, pick him up, though. Don't let him, like, knock over all the cameras and electrical stuff. From your hands to Ian's hands.
I might work on making him a therapy dog. We'll see.
Yeah, there you go.
I mean, clinic and stuff like that.
What is your dog's name again?
Gilmore.
Yeah. It could be the Ian and Gilmore show.
That's right. Come here, Gilly.
Oh, look at her. She's so cute.
Oh, we got to go with him. Come on now.
Or him. My bad.
There you go. Come here, Poppy.
He's just like, just please let me hang out.
Hey, it's a good boy.
But no, I appreciate you coming on and talking to us. And
dude, anytime. I mean, certainly, I'm a talker.
I know, but like you just talked about so much fun and exciting, cool stuff. Hopefully some people get some nuggets out of there. But I mean, I love talking about fitness and physical therapy and. Ian knows if I'm showing up, he's probably pulling out some book teaching me something that day. He's like, I don't know what I'm teaching David today, but we'll figure it out.
It's one of those things though too. I mean, the passion that you bring, every single day, it's contagious as well.
Right.
So from like working with you as a patient and stuff like that. I mean, it's enjoyable.
I don't half-ass stuff.
No, that's what I mean. You make my job enjoyable, and I think that correlates though to like even like this and the fitness thing and everything that you got going for you right now. I mean, you're too fit in, you're committed. It's not like you're half-assing it and like that type of stuff, and that's what's going to make you successful. I mean, at the end of the day, is the approach that you're taking of just.
Well, I appreciate it, man. I appreciate it. What are you doing, Gilmore? You wanna say anything? Any final thoughts, Gilmore?
I think he said enough of the yelping.
Oh,
so I think we got him on.
Is it what time does he eat at night? Does he eat before? What time does he eat?
We're past the eating point.
Oh, so Gilmore doesn't like me probably. We're not, but are we buddies? Well, yeah. Thanks for coming on, and guys, thanks for tuning in here at Transparency Fitness Live. And we got some other cool podcasts coming your way here in a few weeks. Have a good one, guys. Bye.